It is Wednesday, October 7th, 2020. Wat Kahnawà Zuguegu, the Kahnawake Welcome to the Kahnawake COVID-19 Task Force update. It is our 139th update since the pandemic began. The COVID-19 Task Force met today, and there are some announcements coming up. We have 3 members of the task force who will present, and we will start off this afternoon with the head of the task force, Lloyd Phillips. Lloyd.
Good afternoon. Thank you once again, Joe. Okay, I'll start off by maybe just making some quick comments regarding the overall situation in Quebec, and I did speak on that and quite lengthy yesterday, explaining the overall situation, which is unfortunately heading in the wrong direction in the Greater Montreal area. No, and at this point in time, there are many unknowns, but we do know the overall situation in the Greater Montreal area is heading in the wrong direction. But there are obviously things that we do know. We do know that it's a critical phase in the pandemic for our community. We do know that there is a backlog of tests that have to be done at a lab, which is causing a large concern and a long delay in getting results for people who have been tested. We know that the community is at risk, and the fact that's the reason why we moved last week quickly into the red area, and we did say we are going to be taking in a phased approach, but we do know that for sure. And we do also know for a fact that most of the spread, or a high percentage of the spread from the virus happened amongst gatherings, whether that be gatherings publicly or privately, and that's why we took measures last week to start limiting public gatherings and move to minimizing private gatherings. And this is proven scientifically, and it's not just in Kahnawake I'm speaking about. I'm talking across the board where evidence has been proven. So I have a graphic coming up here that I want to remind the community on. This last week, and it talks about the bubble that you think you have, and the terminology we've been using a lot lately about bubble. But basically saying living in your home, and you have a few people that you associate with, where you think that's the green section is who's in your bubble, but then in reality, because each person in their bubble may have a connection with another group of people, so your actual bubble is much more significant than you may think. You may only think you're associated with 4 or 5 people, but in reality, you're connected with too many other people through various different, associated bubbles. So where you think you're with 4 or 5 people, that bubble could easily extend into 20 or 30 people very easily. So it's with that thinking and moving forward that we decided we have to take some additional measures to minimize the spread in our community, because as we know, with the cases recently in the community, it did shake many people, and did raise the level of fear in the community as a whole, but it also made the task force have to take some tough decisions. So with that said, after a discussion, lengthy discussion with the task force, and after consulting with Dr. Gauthier, who felt that the decision that I'm about to announce is not a matter of debate, that it's a scientific fact. So what we are announcing today is that gatherings in the private residences is further to be restricted, that you are only to have gatherings for people who live within the same household. So what that means basically is if you live in the home, that is the home in which you are to stay, no mixing of households. So only people who live within your household are the people who should be in your household. This will take effect on midnight on Friday, so people have a chance to do what they have to do over the next couple of days, and if you want to maybe visit somebody in a safe way, you'll have time to do so, because this measure will be in place for a period of time yet to be determined. But I could assure the community that it's going to be assessed often, and if we could remove this measure sooner rather than later, that is our goal. We do not want to keep it on longer than we have to. So that's a measure that we're announcing today, and we're looking to the community to continue following the measures the way you have been doing, and looking at this on a personal level, and each individual family to take ownership over their household, and ensuring that only the people within your household are there and keeping themselves safe. It is everybody's personal responsibility to ensure that this does happen, and it is a critical factor for us having success down the road. I do know that this type of measures are further restrictive on the community members, and the decisions certainly are not taken lightly, and it does present a level of anxiety and stress on individuals. And coming up to speak next is the Executive Director of KSCS and a member of the task force, Derek Montour, to speak a little more on that. Thank you very much. See you tomorrow.
As Lloyd said, my name is Derek Montour. I'm the Executive Director of Kahnawà Community Services. Lloyd mentioned a few key words: anxiety, sense of normalcy, stress. All of these words really are fundamentally mental health questions. All of us are going to be striving for a sense of normalcy in these times that are anything but normal. And I think the challenge for all of us is to try to figure a way for all of us to adapt. And I believe this, and everybody can see it, this is the same for every community across the world. We're all needing to try to adjust our lives to this constant unknown of really going from a yellow to an orange to a red, possibly back to an orange, maybe future back to a red, and we're going to be living in these times. And it is so important right now that we talk about it, and we talk about it amongst our families. We talk it amongst, particularly with blended families. We've been getting a lot of questions lately about custody issues, custody questions. In the first wave, we had put out some information, so I want to reiterate some of that tonight. The number one, I guess, hope that I have is that parents can talk together. We understand that custody can always be a challenge amongst parents, particularly if you don't see eye to eye. But every child has the right to access both of their parents. That is a fundamental right to have both of their parents in their lives. So we understand that Lloyd's announcement just now is going to cause people to questions and concerns. Well, what about my child? They go on weekends there, or we switch flip-flop. Well, this child is living in both homes. So I'll reiterate what we had written before, just so you can recall, and we'll put it out on. We'll post it as well. So there's no clear rules for these situations. Having an emergency pandemic mixed into custody situations are always complicated, but more so during the pandemic. And the need to reduce the spread of virus while respecting a child's rights to have access to both their parents is paramount. Inevitably, a parent's job is to keep a child safe no matter what. Assuming we're talking about the health in the current pandemic, it would make sense that the health of the child, in addition to limiting their exposure to the virus, would come first. So when visits are not possible due to self-isolation or poor health, the regular visitation time should be respected and done by FaceTime, Messenger, telephone, even texting. Children need to have a sense of normalcy even during these uncertain times. All of us need to have that sense of normalcy even during these uncertain times. So when parents have that adversarial relationship, unfortunately we know it happens, We ask that parents do their utmost to try to talk about it with the other parent. Come up with a plan and come up with a safety plan for the family and the child. It's really about protecting your child. If in doing so you're going against a court order to do that, please contact your lawyer for legal advice or directions. KSCS is obviously open and ready to provide support services for psychosocial needs, depending on the issues. We can help you process the feelings you're going through, even grieving and self-isolation and anxiety and all of those other feelings that all of us are going through. We can provide assistance with co-parenting, can provide referrals for relevant services, whether depending on your individual family needs, but we can't provide legal advice or make any decisions on your behalf as a family. Those are things that you as a family have to do. We have, our services have never stopped providing essential psychosocial services. We're asking you to really think about it with your family together and start working out and start talking about these needs well in advance. We know that children are going to be looking at video conferencing. We know there's going to be challenges that each family is going to meet. You're going to have questions. Please don't be shy. If it's dealing with family issues, if it's dealing with anxiety, mental health, give us a call at KSCS. Our number, as you may know, 450-632-6880. And I do want to put a plug in for the food services. Some of you may be even experiencing that. We know there's going to be challenges and anxiety related to employment. If you're experiencing food shortage issues, please call KSCS. There's the self-isolation chamber as well. Not chamber, but shelter. That way, if you need support that way, you can get support to provide shelter. Again, 450-632-6880. Now, Koa.
Now, Derek, of course, very big news here today. Just a note that if you're having repairs done at your home, you have the pool guy coming to close up, and if you have some construction going on at this point, that is still permitted, right? So that's just something we figured we better let you know. And things will continue to change on probably a weekly basis. At this point, it's time to bring in the executive director at the Catering Memorial Hospital Center for a further update. And of course, she's a member of the task force. Let's bring on Lisa Westaway. Lisa.
Good afternoon. So I have various updates to provide. They're not interrelated. There's a lot of different information to provide one after the other, so I'll try to be brief. So firstly, I wanted to talk about the Canada app, the phone app for contact tracing. So you may have heard that Quebec has made a decision to adopt the use of that app here in Quebec. And so we've received a lot of questions about it, and we wanted to talk a little bit about it. So firstly, to say that that we do recommend the use of this app. I'll explain to you how it works. So our phones all have Bluetooth capabilities, and when our phones are within 2 meters of each other, this app sends out signals through Bluetooth that translate into codes that are saved into your phone for a 2-week period. So there is no contact information, no names. It's simply a random code that is generated whenever a phone is within 2 meters of you and is considered a contact. And again, those codes are saved in your phone for a period of 2 weeks at a time as you go along. So if you do become COVID positive, the app will give you a specific code, kind of like a key, that you will input into the app, and the app automatically accesses those saved codes that are within your phone and sends out automatic text messages to all of the phones that were within a 2-meter range of you within that 2-week period. And that text message basically alerts someone to the fact that they have possibly been in contact with a COVID positive case and that they should self-monitor for symptoms. So that's how the app works. We do suggest that you use it. People who have older phones are unable to download it onto their phone, so you may have some difficulty in that case. However, it's not the be-all and end-all that will solve all of our problems, but it's an extra tool that can assist us. Again, as we had already mentioned in the past, we really urge you, when you do go out, that you document what you're doing, who you're with, so that if we do end up contacting you saying that you are positive after a test, that you are easily able to identify who your contacts have been. But what we see when we do contact tracing is that this is a really difficult experience. It's difficult to remember. So the app is just an extra little tool that can facilitate and advise people that they have potentially been infected with the virus. A second point, a question that we've received, is regarding immunity to COVID-19. So perhaps Dr. Gauthier can give a lot more details about this in future Facebook Lives or radio. However, just to give the basics, we do not have a lot of research, scientific research, that tells us that we are immune once we've already had COVID-19. So the most that we know now is that it's for an approximate time of about 2 months that we are potentially immune from catching COVID-19 a second time. And therefore, just because you've already been positive doesn't mean that you can freely go about your business and that you don't have a risk of becoming COVID-19 positive a second time, nor of infecting a loved one. And so it's really important, despite the fact that you may have already been positive and done your self-isolation in the first wave, you may still be reinfected with COVID-19 now in this second wave. So we felt that it was important to communicate that information. I wanted to talk a little bit about inpatient, and as you know, for inpatient at KMHC, we are in the red phase, and one of the elements that is no longer, that we can no longer continue during the red phase is drop-off of items for loved ones at the tent site every 2 weeks. So it just so happens to be that this weekend would have been a drop-off date, so I just want to advise the community that we will not be accepting any items for drop-off for your loved ones, and a communique will go out about that tomorrow. But we wanted to just give you some time in advance to advise you. Wanted to talk about Halloween. So we did, Halloween was a topic of conversation at the task force today. What we all agreed upon is something that we've already mentioned, that we don't have any intention of canceling Halloween. We do, however, have intention of publicizing and doing a media campaign on safe ways to have Halloween. So the idea is that we're able to continue this event that is very popular here in Kahnawake, but how do we do that in a safe way? How do we mitigate risk as much as possible? And so you'll be getting more information about that probably starting next week. Testing site. So just to let you know that we continue to test. However, we only tested 12 people today. That is very low. Prior days had been close to 40. Yes, we are now open 5 days a week, but I really want to reiterate the importance of coming to be tested if you have COVID-related symptoms. This is imperative. Despite the fact that we're waiting a long time for results, and despite the fact that it's difficult to self-isolate once you've been tested, it is really, really important to come and get tested if you have symptoms. It's the only way that we will have a good picture of what's happening in the community, and it allows us to make better decisions about measures to implement. So when it comes time to making a decision about opening up our households to our family members, we can only do that with appropriate information and with the knowledge that the community is in a safe place. If you're not being tested when you have symptoms, then we're not able to make those decisions with confidence. We right now have 6 positive cases in Kahnawà, so there is an additional case from the last time that we made an announcement. So we do see that the numbers continue to increase, not just around us, but in the community as well. And a reminder of a very disturbing element that I've discussed yesterday and the day before is that we still have many outstanding tests without results at the present time. So we have received results up to the 30th of September, and anybody who was tested after that date may still be awaiting results. We urge you to stay in isolation until you receive your results, whether your symptoms have gone away or not. And because of the backlog in receiving test results, again, very important, as always, but even more so now, to stay 2 meters apart, to wear your masks, to have, to practice appropriate hygiene, and to keep a healthy distance from your elders and people who are vulnerable, because we just don't know who are the contacts of potential positive cases. Again, we don't have enough information to be able to safely make those decisions, and therefore the control that you have of yourselves and of your environment is to protect those around you. One last element about the announcement that we made today is, we do receive this question often, daily. How can it be that I can't have my family member in my home, but yet businesses, retail businesses, the tobacco industry can continue, gyms can continue to operate? This doesn't make sense. It's not logical. We understand that this is a natural reaction, and it doesn't seem logical on the surface of it all. We all agree. However, we really want to continue to reassure the community that these businesses are remaining open because they are in controlled environments. They are inspected on a regular basis. We have not had a single outbreak or case related to these business openings. It would not be the right thing to do to completely close down the community. We have to target the areas that are the most at risk, and those areas are really around gatherings at the present time. That is what we see all around us. It's what we even see in our own community. And therefore, that's the reason why these businesses, for the time being, are remaining open. And again, this is an analysis that we do on a daily basis in order to make decisions about how to best protect ourselves and our loved ones. So Derek mentioned, Lloyd mentioned, we know that this is a really difficult time. This is a difficult change. We had progressed through our gatherings in our private homes very slowly towards this phase. And we would not be at this point right now if we didn't feel that it was the safest measure to put in place for all of us, for our own safety and for the safety of those around us. So we really urge you, again, as was already mentioned, to talk to people, to find ways to communicate, to practice things that make you happy on a day-to-day basis, whether it be reading or meditation or just talking, whatever that may be, in order to help you through these times. And we will continue to keep you updated. And again, we reassure you that as soon as we can come out of this phase, that we will, as soon as we feel that it's safe to do so. Thank you.
All right, thank you very much, Lisa. And thank you very much to Derek and Lloyd as well. Some pretty dramatic developments here as the pandemic continues to be in the red phase, and certainly we are not immune. So once again, the big takeaway from today is that no more gatherings except for people who live in the same household. So that's going to be a little bit difficult, as we know this weekend coming up is a long weekend, and it's Thanksgiving. Usually you have family gatherings at that point. So We have to make adjustments once again in our lives. We have been doing that for the past 7 months. So we can get through that. We can get through this as well. With that, I just wanted to let you know that with the long weekend coming up, we will be taking a bit of a break, and we will be back on Tuesday, next Tuesday, with our next update, unless something major happens. We're hoping that we can continue on the path and take care of ourselves and each other. So on behalf of everybody here at the Kahnawake COVID-19 Task Force, we'd like to say, for joining us. Thank you very much, and we'll see you next time. Take care.